Okay, so today we're going to learn how to enter in patient data into the system, to the Marquette EKG system, stress testing system, and then we'll also learn how to place electrodes on the chest. So the first thing you need to do is you need to click on New Test, and then we need to click on New Patient, because our subject here, Brian, has not been entered in the system before. So you just enter in the last name, first name. You do not click on patient ID. You click on the dice. It will assign a number, so you do not enter anyone's ID number. It assigns it to you. Then you enter date of birth. And the only thing that's tricky on the date of birth is that you need to put in all 4 digits for the year. Then it's going to ask for height, and you need to put that in inches. And so, Brian, you're 5'11", so and a half. And how much do you weigh? 150. Porker. Select gender, and then you select race. And once you do that, then you need to click on the accept. It's accepted his data, then you click on New Test, because this will be a new test that we're going to conduct. We will not conduct a full stress test today. We're just going to learn how to place electrodes and get a baseline EKG. If we were doing a full test, we would click on the protocol that we're going to use, which is always going to default to Bruce, so you should not have to change that. The only thing that you really need to change in this spot here is their target heart rate. And so ideally we want to have 85% is the minimum bar, and then it will automatically calculate your max heart rate. Once you enter in 85%, all you need to do is click on OK. Once that patient data has been entered, then we're going to go ahead and start to prep the skin. So I'm going to turn you sideways here. Okay. So electrodes are going to come in small packs, and you always need to double check the expiration date on your electrodes. So on the box, the outside of the box, as well as on the bag, you should find some type of expiration date, so that when you open up your pack, your silver pack, you'll open up the individual EKG electrode itself. Always double check and touch the middle part, which is the jelly part, which is the conduction median. You need to make sure that that is wet. Some electrodes can, if they are expired, they can dry out, and then you are not going to be able to pick up any type of signal. So that median there is your silver chloride. And again, it's going to be, should be nice and wet so that you can pick up the signal off of the skin, so then the computer can take that signal and then convert it into an EKG signal. Okay. So the first thing you need to do is prep the skin, and we need to clean it. We have oils, natural oils on the skin. If anyone's put on lotions or whatnot, it's going to make it even harder for the electrodes to stick. So again, alcohol, we use alcohol. It's a nice drying agent. Prior to the alcohol, you need to make sure that if you were to have an individual that was covered in a lot of hair, that you would use a razor, shaver, and shave the skin in the spots where we would be putting the electrodes. If you do not shave the skin, the electrode cannot make good contact. If I don't have good contact, I will not be able to pick up the electrical signal. And trust me, if your electrodes start to fall off during a stress test, you're going to have lots of problems. You won't be able to get a signal. The physician will not be able to interpret the 12-lead EKG. It's not going to go well. So I don't need to shave Brian's chest. He's hairless, so we're going to take alcohol and we're going to clean the skin. Now, where do we place the electrodes? You're going to go mid-clavicular, right in the fleshy area of the pec. That makes for a great location for placing the electrodes. You do not want to put your electrodes on top of bone. Bone is not a good conductor for signal. So once I clean those two, those will be for my right arm and my left arm. Then I'm going to come down and I have 6 chest leads that I'm going to place on. They're called V leads or precordial leads. They go in the fourth intercostal space. So if you take your finger and you go diagonally from that clavicle, that is your first intercostal. If you take your finger and roll over, you can, that's 1 and 2. If I keep that spacing, go 2 and 3, 3 and 4. And that I want to be fourth intercostal, and typically with men you can go nipple level. For women you cannot use that as an anatomical location. You must palpate so that you can get into the ideal location. So again, I have 6 chest leads. V1 is in the fourth intercostal space on the right sternal border, and V2 is right across the street. It's in the fourth intercostal left sternal border. So those are my two V1 and V2. V3, 4, 5, and 6. 3, we're just going to go down along the natural line of the chest here on the pec. And what you're doing is you're in the fifth intercostal space here. And we're going to go mid-clavicular line, anterior axillary, and then mid-axillary. So just follow along with that rib, and that's where you're going to be placing your electrodes. Okay, so I have cleaned my 2 arms and my precordial leads there. I also have 2 legs. Most of your textbooks will tell you to put them down here. I don't recommend that. I spent 10 years in the clinical world, and if you put the belt right there, they have a tendency to rub off. So we pull them up onto the chest, and you either put it in a V5 or V6 position over here, which is anterior axillary in the fifth intercostal, or mid-axillary. The more that we can keep them up on the torso, they will be actually more stable and you won't pick up as much interference. When we think about cardiovascular disease patients, they have a shape. A lot of them are apples and pears, but there's a lot of girth in the abdominal area. And so when you place those electrodes in that area, again, you want to make sure that you're on top of the fold. Don't get down in the fold. Because again, when it gets down in that fold, then that tissue or that skin can rub on it and pop that electrode off. So again, I don't recommend going down on the low abdomen or up on the hip because of the belt as well as the real estate. I call it real estate, okay? So what we need to do is clean in those 2 areas, and I'm going to, again, get ready to place my electrode. So we've given that a little bit of time so it can dry. Alcohol is pretty quick to dry. And then the next thing that I need to do, because we have several layers of skin, and you can have a layer, you can have some that is provide some interference. So again, I'm just going to take, it is a small little piece of sandpaper. Okay? Can you see that? It's sort of like, it's sandpaper, okay, but it has a little sticky back that you can stick right on your finger. And then all you're going to do is go over the same spots of where I'm going to place my electrodes. Now, you do not need to draw blood, okay? So it's just lightly on the skin of where I'm going to place my electrodes. And you can see Brian has sensitive skin, so with just slight alcohol and a little bit of a scrubby, I already have some red splotches. So again, you do not have to draw blood. So the electrode placements. I have 2 arms. This is going to be the right arm. And basically, there's just a little white tab, and you just peel it apart. Okay, so again, find that intercostal or that sternal notch, come over diagonally. That's 1, 2, 2, 3, 3, 4. So you want it to be fourth intercostal space on the right sternal border. I don't recommend doing this in gloves, but. All right. So I'm going to do V4, which is midclavicular line. So find the clavicle, come right below the breast, and you're going to put it in the 5th intercostal space. That's V4. V2 is, or V3 is going to be splitting the difference between 2 and 4. Okay? V5 is anterior axillary, 5th intercostal space. So just follow that rib right along. That's V5. And V6 is going to be, lift your arm up to the side, is going to be midclavicular line in that same intercostal space. So you just follow that rib head right along. Mid-axillary? What did I say? Oh, I'm sorry. So let me rephrase that since I messed up. Lead 1, or your arm lead, or your arm electrodes, midclavicular line. Other arm, midclavicular line. V1 is going to be 4th intercostal space on the right sternal border. V2 is 4th intercostal space on the left sternal border. V3, you're going to split the difference between 2 and 4. So 4 has an anatomical location, which is midclavicular line, 5th intercostal. So split the difference for V3. So you just go backwards. V5 is going to be anterior axillary, and then V6 is going to be mid-axillary. And all those are in the 5th intercostal. V4, V5, and V6 are in the 5th intercostal. Okay? Then I have 2 legs. And what I like to do is I like to drop the left leg right below V5 and V6, but up on the ribs. Again, I don't put it down here. Okay. And then the right leg, which is the ground, and Dr. Hoffman can explain what a ground is for, is going to be over in the V5 or V6 position. So again, in that 5th intercostal space, either anterior axillary or mid-axillary. Okay. And that's your placement. Okay. Now all we need to do is hook the cables. Please don't memorize colors. They tell you on the lead what it's for. So LL means left leg, RL is right leg, and so forth, okay?